CLAUD-IT supports EU member states in the implementation of clinical audit in radiology and nuclear medicine. It brings together hospitals, authorities, and societies to develop audit methodology leading to improved healthcare and patient care across the EU. The project has already successfully updated existing ESR Esperanto Guide to Clinical Audit to its new, updated, and expanded version, AUDITRAD. Listen to the scientific coordinator of the CLAUD-IT project, Professor Roman Kluckner, and the WP4 leader, Dr. Nuria Bargallo, discussing the importance of clinical audit in radiology and radiation protection, the updated audit guidelines, and how the CLAUD-IT project intends to support hospitals in implementing clinical audit in their regulatory operations. Professor Kluckner, the first question to you. What is the current state of clinical audit in Europe? Why is it important?
So first of all, clinical audit is a very, very important quality improvement tool. Regarding the state of implementation, I would say it's complicated. We have certain countries, first and foremost the UK, which run an excellent audit system. So the UK are doing that for decades now. Unfortunately, they are not any longer member in the EU, but still a very important partner in Europe. We also have other countries, for example, like Finland, who also have a well-functioning auditing system. However, having said that, especially the large countries, for example, Germany, where I'm based, or Spain, where Nuria works, but also Italy and France, have the issue that the level of implementation of clinical audit is actually too low. It's not as high as it should be. And that's basically the major question or the major issue we try to address by this EU-funded project.
Mm-hmm. And what is the situation in Spain with your experience?
Yeah, well, in Spain, I think we have audits, but usually they are external audits for qualification of for having some kind of quality certification, but not internal audits. And I think it's very important that we as a doctors learn how to do clinical audits, because then we can, improve the way we work. I think it's very important for us to do this and to learn how to do it. And I hope that this project will help to implement this in our work in our clinical practice.
Mm-hmm. Professor Kluckner, why is it so important for institutions? You spoke on the national level, and who is satisfying to your opinion their goals, but why is a clinical audit so important for the individual institution?
So clinical audit is basically the central, or one of the central quality improvement tools. And maybe to quickly, I want to very quickly tell our audience what clinical audit essentially is.
Please.
So it's basically about improving yourself. So you pick a process that might have to do with CT, MRI, angiography, or even some administrative process. You're completely free in that. You pick this one and you want to take a closer look on it. So you define standards. So you ask yourself, how should this process be? You write that down, and then you dive into clinical reality. For example, you look at the last 50 cases, the last 100 cases, so that largely depends on the use case. And you compare the real data to the situation it should be. And maybe you find out everything is perfect. But maybe you identify issues that are maybe not perfect, so you invent improvements, and you can change things. And afterwards, the audit cycle, as we call it, begins again, so you can check whether the improvements you suggested really improved the situation.
Mm-hmm. Professor Bargallo. Dr. Bargallo, sorry. Please explain the updated and expansion of existing ESR guidelines for clinical audit in radiology to AUDITRAD. What's been changed?
Yeah, well, I must say that this Esperanto was now, as you said, we rebranded to name AUDITRAD. This Esperanto was an ESR guide that was published a long time ago. Now we had the third version. With AUDITRAD, we will have the fourth version. And what we have included in this new version is some important sections, like the role of CLAUD-IT with the role of audits with value-based, for instance, because value-based radiology is also an important topic, and sometimes we don't know how to measure this value-based, and I think it's very important to create these new templates and the importance to audit some of the procedures that we're doing in order to see the value that we are giving to the patient. Also in this new book, also there is a new section about AI. AI is also very important for us as a radiologist, and AI can help us in two ways. Well, in two ways, no, what it can help us to implement audits, because AI can collect a lot of data, and then we can easily see how we are doing. But on the other hand, also we need to audit how the AI software is working in radiology. So it's two things that we need to think about. And finally, also we include in this new AUDITRAD some information about some projects that ESR has, like Quadrant project, that was also a project related to implementation of audits, and also the EU Just CT, that was a very important project that was also evaluating how the referrals request the examination. So we also give in this book information about these two projects. And finally, I think the most important is that we include more than 55 new templates. And these 55 new templates are related to MRI safety, justification, as I said before, radiation protection, and AI, and value-based. And I think the last thing I want to say about this AUDITRAD is that we also try to categorize the templates in also 5 sections. For instance, if they're related to quality, safety, value-based, radiation protection, and justification.
Well listed.
A lot of work. We did a lot of work.
You hit them
Indeed,
all.
indeed.
Yeah, yes.
Excellent job.
Yeah, and also I want to say, sorry, that
Yes, please.
that was very nice, because we engaged a lot of people. We engaged a lot of subcommittees of the ESR, and they were very helpful with us, and they give us a lot of new templates. The MRI safety group, the e-health and informatics subcommittee. So it was a very collaborative work.
Great. Professor Klockner, back to you. How does CLAUD-IT support EU member states in clinical audit implementation and project methodology?
So we try to support the EU member states actually at several points in conducting clinical audits. So CLAUD-IT is a multi-step project. First step is about primarily identifying the needs. We're basically building upon the results of the EU-funded Quadrant project and the EU Just CT project, and also identified additional needs. Step number 2 is about developing audit-related material directly addressing these needs. Nuria just mentioned the AUDITRAD guide, which is a central document. I will talk about other ones later. Step number 3 is to actually start audit. So we have a first round of audit. After we have conducted this first round of audit in our, we call it core hospitals, we step back once, we take a look at that, and we try to learn from the first round of audits. We maybe modify or optimize our methodology a little bit, and then we go out in the field and try to disseminate the whole thing by doing second round of audit in a much greater number of hospitals, so that in the end we hopefully have at least 300 audit-trained specialists in Europe.
Dr. Bargallo, what are the significant updates in this 4th edition to the Esperanto ESR guide?
Okay.
What are the updates in the 4th edition?
Yeah, no, I think I said before.
Oh, you covered that in...
Yes.
Okay, yes.
Sorry,
I remember 5, sorry.
No, 55.
Okay.
We did 55 new templates. So,
okay,
yeah.
Fantastic. How can EU radiology departments utilize AUDITRAD for their own benefit?
Yeah, I think is for me that we are not very experienced hospitals doing audits. I think This AUDITRAD will help us to go step by step of all of the procedures. So as you said, you show us how is the methodology. So I think it's very important to understand how to do it. Secondly, I think, for instance, sometimes we don't know which are the reference. So also he explains the importance of to look for the standard or reference that we want to compare. And for me, also another important thing is that sometimes we don't know how to begin. And I think that you have a lot of templates, and maybe ones are more difficult for us, but there are others that are very simple. For instance, the request, if you think the request is completely filled, or if the request is correct. So I think, in a way, these AUDITRADs will help a lot of hospitals to begin to do it in an easy way, and it also, I think, will guide you in all of the steps to do it.
Mm-hmm. This is an open question to both of you. I'm guessing you're going to have individual experiences. What are the main challenges in conducting clinical audits in radiology and nuclear medicine, and how does Esperanto address them? Let's start with you.
Yeah, well, I will say something that sometimes there are countries maybe that we are a little afraid that to realize that we're not doing things well. So personally, there are doctors that they don't feel that they don't like that to be, evaluated, and I think it's a culture that we need to change, because as I tell to my colleagues, when we evaluate ourselves, sometimes we see some mistakes that we are doing, and it's not because we are not good. Sometimes we are not good because we don't have time, or we have a lot of interruptions. So I think it's a very good way to use these clinical audits to improve the way that we are working. And I think it's very important to do this. I think we need to change this culture in some of the countries, and I think with CLAUD-IT will help us, will teach us. I am very excited to be one of these hospitals, because I think we will have external teachers that will help us how to do it. And I think I think the first time is always difficult, but then I think we will get more happy with this, and I think we will include this in our clinical practice.
Is that one of the points you, as a selling point to a potential institution, you say, look, this is expertise coming in to improve you, and is that well received?
I think yes, because now I think quality, people are more and more aware of quality. We need to improve quality because, as I said before, value-based radiology is a new concept. Before we used to have like more volume, but now we are changing to value. So quality, value-based radiology is one of the measures is the patient outcome. So I think it's very important for us to do this, the quality, to improve our quality. Yeah.
And Professor Klockner, same to you, the challenges you see and how Esperanto addresses them.
So I completely agree with Nuria about this cultural thing, and maybe even some doctors are even afraid of sanctions because they confuse that with inspection, for example, which is not the case, which is an entirely different thing. I would like to add one more component which I believe is very important, or maybe two. One is, I call that resistance to change. I mean, I think this is a very human thing, actually. The second one is actually a lack of resources. I mean,
it's true.
Audit, that takes time, it takes personnel. In the end, it costs a lot of money. And nowadays, people believe, okay, the resources are so low that we cannot afford that, which is actually absurd, because on the long run, actually, clinical audit will save money. But of course, on the short run, to set up a functional clinical audit system will cost money for sure.
What other resources will CLAUD-IT develop? What's in the pipeline?
So we also develop other audit-related material. Nuria already mentioned AUDITRAD, which for sure is a very central document in this EU-funded project. And actually, I'm very proud to mention Nucline. Of course, this is a radiological congress, but Nucline is pretty much the same for the nuclear medicine world. And of course, we try to use as much synergies as possible. And this is actually the first audit-related document in the nuclear medicine world, and I'm really proud of our colleagues. So I think this is really a great step forward. And a second document which will be central in this project is I always call that internally audit cookbook, which is basically a step-to-step guide how to start with clinical audit, how to set up a functioning audit program, how to continue with audit. And I think this is super important for the partners because it lowers the entry barriers.
Mm-hmm.
Yeah, and I want to add something else, that we will do an open repository of this material. So this is very important.
Yeah.
So if you
sorry, I forgot that.
No, but I think it's very important.
So it's a very important point. Of course, we will make all these materials available for download for free in an online repository. On top, lots of supplementary material, and I think this is the only way to make this project as sustainable as possible.
Mm-hmm.
Yeah, and also because we will be open, maybe people can also came with new ideas, and we can increase all the material that we will have inside.
Right.
Yeah.
Speaking to outreach, outside of our session here, which I'm sure is a huge help, but how do you engage local stakeholders? What's your methodology behind that? What have you seen that works the best currently?
Yeah, no. Well, I think I think in CLAUD-IT we have an implementation board, and I think it's very important who will be there, and we have tried to engage of the societies, for instance, all of the countries that participate in this project, the national societies of radiology and nuclear medicine, but also more the government agencies. That this sometimes is a little more difficult, because we need them. Because if we don't have, as you said, money or the import or someone that recognizes that this is very, very, very important, and we don't have the resources, maybe we will fail. So I think this is very important for us that the implementation board believe in the project.
Fully agree. I think if we learned something during the last 3 decades, that is actually that you need all the stakeholders on board. On the one hand side, the stakeholders on the medical side, like the physicians, radiologists, nuclear medicines, but actually also the entire support staff, like technicians, quality managers, IT staff, very, very important. So this is really central. But on the other hand side, you need political support. And that was exactly what Nuria just pointed out. So the national radiological societies, nuclear medicine societies, and of course, the national competent authorities. Actually, it wasn't easy to get them on board because the situation differs from country to country.
There's no one size fits all for each.
Absolutely.
Yep.
But I think in the end, this is essential for the sustainability of this project. And I think, it's designed as a 3-year project, and of course, we want to have it an impact that lasts.
Mm-hmm.
Yeah, of course.
Dr. Bagallo? Professor Klockner, anything to add, please?
No. I was saying that you agree, because the countries are very, very different. In my country, Spain, the central government, the health system is not in the central government. It's all in the regions.
Very regional.
Mm.
So it's all of them have to decide to participate in this. So it's difficult sometimes to.
A similar situation in a federal system like in Germany?
Absolutely.
Okay.
Absolutely. Yeah.
So you have to talk to individual regional organizations.
Yeah,
okay.
Definitely.
Well, it sounds like you both have a good handle on it, and
Thank you.
Improving systems and departments all over Europe, hopefully. Continual improvement. Thank you very much for joining us here in the ECR 25 studio.
Thank you.
Thank you very much.
And thank you for joining us. That was our final session here within the studio. We will be back at 6:15 with our final daily wrap-up for Saturday here from ECR 2025. Thank you for joining us.